Hello, I'm Johnny.
Nice to meet you, Johnny. Today I'm going to be assessing from the back of your neck to about the top of your belt line. Would that be okay if I expose any of that area if I need
Yes.
to? Okay, awesome. Is it okay if I palpate you today?
Yes.
Awesome. Okay, so first can I get you to please take off your shirt while I check this table?
Yeah.
Okay, that feels good. And then I'll have you sit facing that way. Is it okay if I touch your face?
Mm-hmm.
Okay, so now can I get you to lay face down on this table? And would it be okay if I expose this area a little more by just tucking your pants?
Yes.
We chopping? We edited.
Okay, sir, can I please get up now and then sit on this end facing that way?
Yeah.
Back for me. I need you to cross your arms across your chest. Did you cross your arms, please? So now I'm going to be assessing your atlas. So if I can get you to stand as close as possible with your feet together without touching them. Just a little more. Spread. Thank you. Okay. And with your eyes closed, I want you to flex and extend your head or bring your chin to your chest. And then whenever you feel comfortable in a normal stance, just stop your head. Okay, so he's just slight, he's got a slight depression. He does so has an inferior atlas. Okay, so now I'm going to be checking for rotation and translation of the atlas. So if you please have you sit down facing that way. Okay. I'm going to come up here.
So my contact points for the seated position where the bisecting the iliac crest, finding the PSIS and just going medial to it, placing my palm on there, assessing for joint play. And then for the rest of the spine, such as the sacrum, lumbar, thoracic, and cervicals, having kind of a fist-like posture and not assessing every vertebra, but going from the sacrum superior up to the cervicals. Checking for any restrictions. The restrictions that I did find in the seated was the right SI joint, so that area needs to be further evaluated. Also, the lower portion of the sacrum, the apex, needs to be further evaluated. On for there for the sacrum, sacroiliac joint, SI joint, contact points were medial to the PSIS with the superior hand, and with the inferior hand on the ASIS, pushing from A to P to assess that joint. For posterior glide, for anterior glide, keeping the superior hand where it's at, and the inferior hand is bringing the knee to flexion for 90 degrees, and then holding on to the ankle and pulling up in a direction kind of towards the head to check for anterior, and then for lateral and medial, just moving the leg away from me and moving it towards me. There was a posterior glide restriction. Moving on from there, from the sacrum, 3 contact points on the base, 3 contact points on the apex. For the base, just medial to the PSIS's tissue slack, or tissue pull, pulling from inferior to superior and then pushing P to A, medial to the left PSIS, medial to the right PSIS, and then being on the midline for the transverse for the nutation. Then for the apex, the tissue pull is superior to inferior, and then a motion of P to A to assess the joint and for in play. And this is, you find the sacral hiatus to go from there, and there was a counter rotation notation restriction. Then from there, the lumbosacral junction, bisecting the iliac crest, and then going straight across to find the L4 spinous process, going down inferior L5, and then finding the lumbosacral junction, placing the superior hand or superior thumb between the L5, S1, forming a bridge. Then with the inferior hand, checking for rotation of the left side, contacting the right ASIS, pushing A to P.